Welcome to a moderated discussion with Dr. Charles Dupre, Superintendent of Fort Bend Independent School District, and Dr. Grenita Lathan, Interim Superintendent of Houston Independent School District. My name is Shazia Bimani Kazi, and I am the proud Assistant Principal of Pecan Grove Elementary School in Fort Bend ISD. Today's program is entitled The Outlook on Education, Learning and Teaching in the COVID-19 Era, and is proudly being presented to you by the Ismaili Jamatkhana and Center. The Ismaili Jamatkanas in the United States are more than places of worship and spiritual search. They are places of friendship, dialogue, and inclusivity, reaching out to neighbors to facilitate an exchange of ideas. This is achieved through hosting cultural programs such as educational seminars and lectures, art exhibitions, music and dance, and as a forum for civic leaders and others. At the opening ceremony of the new headquarters of the Global Center for Pluralism on May 16, 2017, the Aga Khan explained, and I quote, "Pluralism does not mean the elimination of difference, but the embrace of difference. Genuine pluralism understands that diversity does not weaken a society, it strengthens it. In an ever-shrinking, ever more diverse world, a genuine sense of pluralism is at the indispensable foundation for human peace and progress." End quote. These spaces hope to encourage community engagement and collaboration on issues of concern, as well as broadening intellectual horizons and fostering an appreciation of pluralism. Today is no exception, as we are pleased to present a moderated discussion with two leading education experts and current superintendents that have joined us here today. Our esteemed participants include Dr. Grenita Lathan. Dr. Lathan is the Houston ISD Interim Superintendent. Dr. Lathan holds a bachelor's degree in business education, a master's degree in business education, and a doctoral degree. Dr. Lathan began her educational career in 1991 as a teacher, then assistant principal and principal in North Carolina. She was named Chief Elementary School Improvement Officer of the San Diego Unified School District in 2008, and interim deputy superintendent in 2009. Dr. Lathan became superintendent of Peoria Public Schools in 2010, where she oversaw approximately 14,000 students and 2,700 staff members. She served as Houston ISD Chief School Officer over Elementary Transformation Schools during the 2015 and 2016 school year, in which she led more than 20 schools out of an improvement required state rating to a Met Standard rating. She served as HISD Chief Academic Officer beginning in 2016-2017 school year until being named Interim Superintendent in March 2018. Dr. Charles Dupre. Dr. Dupre is beginning his 7th year as the Superintendent of Fort Bend ISD, the state's 8th largest school district and the largest in Fort Bend County. Over 61 years, Fort Bend ISD has grown to serve more than 78,000 students at 81 campuses. It is also one of the most diverse in the nation, as families speak more than 90 languages and dialects. Under Dr. Dupre's leadership, Fort Bend ISD has developed a strong foundation for success with a focus on educating the whole child. The district has also seen notable growth in student achievement and has increased opportunities for all students, including traditionally underrepresented groups. Fort Bend ISD was also awarded the 2018 HEB Excellence in Education Award as the best school district in the large district category. And just recently, Dr. Dupre was named the Region 4 Superintendent of the Year. Born in Casablanca, Morocco, Dr. Dupre was raised near Springfield, Missouri. He has a BBA with a major in accounting, master's degree in educational administration, and a doctorate in educational leadership. With a passion for serving children and young adults, Dr. Dupre has invested countless hours in shaping the future of others through his role as superintendent, mentor, Sunday school teacher, camp counselor, and friend. Dr. Dupre and his wife, Seju, are the parents of 2 sons and have a grandson. Today's session will be moderated by Rosina Musani. Rosina Musani is currently a program officer with the U.S. Department of State's Bureau of Democracy, Human Rights, and Labor. In this capacity, she oversees a program portfolio covering Central and Eastern Europe. Programs funded by the Bureau focus on strengthening human rights, reducing corruption, encouraging participation in political processes, and increasing government accountability. Rosina obtained her master's in international education policy from the Harvard Graduate School of Education and her Bachelor of Science in Management Science from Georgia Tech. In a volunteer capacity, she serves as the chairperson for the Aga Khan Education Board for the United States of America. Without further ado, please enjoy the program.
Thank you, Shazia. Good afternoon to our viewers, and a warm welcome to our panelists, Dr. Lathan and Dr. Dupre. Thank you for taking time out of your busy schedules to be with us today. We really appreciate it. You know, most of us have just started or are about to embark on a very unique school year with our children. And there is a lot of anxiety and many questions as to what to expect, not only in the short term, but also in the long term in light of COVID-19. Today's conversation will hopefully address some of our concerns, as both of you will talk about your school's plans for reopening, and as we also learn about the health and safety measures that your schools will take as we return back in a face-to-face environment. I hope we also get a chance to talk a bit about the role of schools, not only to serve as core education foundations, but also understand what roles that schools are also playing in today's environment. And finally, I hope we can spend some time talking about the impact of COVID-19 on the greater education sector. So without further ado, let's jump in. I would first like our viewers to learn a bit about you. You both have very illustrated bios, as Shazia just read, but I think it's important for our viewers to understand what drove you to become an educator, and where did your passion for education come from? So maybe we can start with Dr. Lathan. I hope you can share some of your journey with us.
Thank you. Thank you again for the opportunity to just share information as it relates to the Houston Independent School District this year. Me personally, of course, I started out playing school with my baby dolls and wanting to emulate and model after my Sunday school teachers and my teachers. And I always wanted to be a teacher and to be in the field of education. And I'm very thankful and blessed that I have this opportunity to live out my dreams.
Dr. Dupre?
Well, as you mentioned, I'll keep this very brief, but my story begins in Casablanca when I was born on Thanksgiving Day in 1961 and was adopted by an American family stationed in the Air Force there. And we came to the United States when I was 5. My mother passed away, and when I was 7, my father abandoned me. So I ended up in a children's home in Missouri, a faith-based children's home, when I was 7 years old. And it was really my faith and also the teachers in that public school system that instilled a love and a drive for success, for achievement, for education. And through their efforts, I was able to go to Harding University on a full scholarship and was able to kind of move forward to overcome those obstacles of my childhood, which you really never overcome. But the way that I feel like I've capitalized on that experience is I'm able to see how significant equity is in our schools, how critical it is that we teach our students what we call in Fort Bend the profile of a graduate, that there's so many skills beyond the academic realm that they need to know to be successful in life. And I remind all of our students regularly, we all have some type of obstacle. Mm-hmm. I share mine publicly because I want our students to know mine, but I also remind them some of them have obstacles that are much more challenging than mine were, and some are less, but we all need to learn the skills to overcome so that we can rise and achieve about anything that could be a constraint to us.
Absolutely. Thank you both for sharing your personal stories with us. I think they are an inspiration, not just for our viewers, but for the students who are being led by you in the various schools that you are in charge of. So thank you for that. I would like to start the meaty part of our conversation by talking about the upcoming school year. I'm a mom. I have 2 kids at Fort Bend ISD school, and we are all extremely anxious. Fort Bend just started their school year on Monday, and HISD will start in just 2 short weeks, I believe. And so I was wondering, maybe we can have Dr. Dupre start off. Can you talk a bit about what preparations you've made as we start a virtual mode of learning? I know a lot of parents wanted to start face-to-face, but the greater Houston area has not allowed us to do that. So what preparations have you taken to embark on a virtual mode of learning?
Well, Rosine, I'll start our story back in March. You know, when most of you will recall that we all closed school on a dime. Very quickly, we made that decision, and we did 9 weeks of learning in the spring, what we called crisis education, because it certainly was not near the quality or level of instruction we would typically want in our schools. But everybody pitched in to really have a strong finish to the school year to the best of our ability. But we began even in March to know that it was possible we would be opening school under very extreme conditions this fall. So we began putting together a very organized design team. In Fort Bend, we utilize certified licensed project managers. We've got a change management team, and they worked with our campuses and our instructional leaders to put together a very robust plan that addressed all the things we learned from the spring about how important it is to have consistency, to have equity in all of our schools, to make sure that from classroom to classroom, students were having a common experience, and even across all of our district, so that our teachers would have the tools they need and the kids would have a great experience learning. So all summer, with almost no vacation, our team worked very long hours to prepare to greet our teachers. We actually changed our first day of school by several days to give our teachers a few more days to get ready. We invested in new equipment for devices. We invested in new software that's going to provide more easy access for our students and their parents. And we had a very robust learning plan that we put in place for the new school year. Now, as you mentioned, we did begin 100% online for at least the first 4 weeks. And on August 31st, we'll be then sharing our plans publicly with our board on how we plan to begin the transition toward face-to-face instruction. And I'm sure we'll talk about that a little bit more in a minute.
Absolutely. Thank you, Dr. Dupre. Dr. Lathan, can you talk a little bit about what HISD is doing as you start the year in a virtual format?
Thank you. We delayed the start of our school year by 2 weeks. So our students actually will start virtually on Tuesday, September 8th. Our teachers actually are reporting Monday virtually, and they will be involved in 10 days of pre-service training. We have developed an instructional continuity plan that will guide not only our principals and teachers, but our students and our parents. We have prepared our buildings. We are ready. But as Dr. Dupre mentioned, in March when we closed, we all were realistic and understanding that we would be opening this school year, as he stated, under extreme circumstances. And my team, we actually developed, 2 plans, a face-to-face plan and also a virtual learning plan. And we are just in full virtual learning implementation mode.
Thank you. As parents, we are very anxious to understand what the plans will be around face-to-face learning and when those transitions will take place. And Dr. Dupre, you just mentioned that August 31st is when you'll share your district's plans, and HISD currently is slated to transition to face-to-face October 19th, I believe. Having said that, things are changing very rapidly. And so I'm curious if you can share with us what sort of decision-making process you're using as you think about the transition to face-to-face learning. What city leadership are you talking to? What health leadership are you talking to? And what indicators are you looking at to make the decision to transition to face-to-face?
Well, I will tell you, in Fort Bend, it was important to our board and to our community that we have what we're calling a pandemic management plan, where we're trying to gather data that's directly related to our community. So much of the data that's available to us is on a large, broadly regional basis, which is helpful because we all need to be aware of what's going on in our broader community. And we have teachers that come to us from all over the 9-county region. So that is helpful for us. But for me as superintendent, what I need to know is how many teachers and students within our organization are ill or at risk health-wise and unable to come to work. Because as you've heard me say before, we cannot have school if we don't have staff to staff the classrooms. So we are tracking the number of cases among our staff and students directly. So we are also tracking the number of teacher absenteeism, who is calling in, who's on leave, all of those kinds of things. And then, of course, before we actually begin to implement the plan, we will be asking all students and their families to declare, are they going to continue online all year, or are they going to want to come to a building? So we need that information. We're also going to ask staff, kind of make the announcement at some point during the next several weeks that we are returning to face-to-face. Staff needs to resume coming to the building, and do they have a medical reason that they're going to document that would prevent them from doing that? Otherwise, they would be expected to return at a certain point in time in the near future. And so the data we're using, we're absolutely using regional county data, but we're also gathering a number of metrics, as I mentioned, about attendance, about illness among our own staff and students to really drive our decisions. The other thing we've done is we have an advisory committee made up of a number of healthcare professionals in our community, as well as some moms and dads and some business leaders, some community members to kind of listen to our data, study the data with us, and advise us on making recommendations.
Thank you. Dr. Lathan, is there anything you'd like to add from an HISD perspective with respect to your decision-making process?
So we also have a communicable disease plan committee that was formed in the spring that developed a plan for us to return to face-to-face instruction. We have utilized resources from our city and county health departments. We have a COVID gauge that's actually aligned to our county health department. And so we do and have looked and relied on those metrics and recommendations that our county health department has shared with us. We've surveyed our teachers and our parents, and actually a survey went out to our teachers on yesterday. We will be surveying our parents starting Monday, August the 24th, to find out what is their preference as it relates to face-to-face instruction and remote learning beyond October 19th. 4 weeks into our online learning, we will announce, of course, the full transition plan for face-to-face instruction, aligning those courses. So we have our master schedules that are designed around virtual learning, but we also have master schedules designed around face-to-face instruction. But the next several weeks are going to be crucial for all of us in making that decision. Our buildings are being ready to receive students and staff with signage, the additional cleaning materials that they need, hand sanitizers, all PPE. We will be providing that daily for all staff, all students. And there's enough that we are fully prepared to ensure that everyone is safe. And we will be utilizing, of course, contact tracing. Definitely as it relates to our staff, and then our school nurses. We have an outside agency helping us with contact tracing for our staff, and then our school nurses will be utilizing it for our students.
Thank you. We all recognize that while many of us will be ready to return to school, for some families that's not going to be an option, and they will opt to follow the virtual learning model maybe for the first 9 weeks or the first semester, or maybe for the entire year. How, and maybe Dr. Lathan, you can start us off, how are you going to ensure that there's equity between the virtual platform and the face-to-face learning model so that both sets of families are getting a good experience and an equitable experience as they go through the year?
Expectations, that's expected, whether a student is learning in a face-to-face environment or virtual environment. The same level or requirements as it relates to minutes of instruction for a class period for the school day, attendance verification, assignments. So that same level of expectation when we see students face to face every day, it's the same as it is in a virtual format. So there's no, if someone thinks that they're choosing virtual, that it's going to be less rigorous. That's not the case. It actually will be more rigorous. And that's what I've been pushing on my staff. These first 6 weeks for us is we have to make sure that every minute counts because, we have so much to catch up on and the lost time to make up.
Absolutely. Dr. Dupre, is there anything you want to add from a Fort Bend perspective with respect to equity between the two platforms?
Yes, in Fort Bend, we've actually been addressing equity as they have in Houston ISD for the last 7 years. And so the common denominator is all teachers in both platforms will be teaching our prescribed district curriculum. And we will have schedules built for both online and face-to-face that are intended to make sure the students move through that curriculum at the same pace. Because ultimately, that's the bottom line. The what, we refer to that as the what. Mm-hmm. We want every student to have access to that curriculum with appropriate interventions and remediation that they need to make sure they are mastering and learning that curriculum deeply as we move forward.
Well, we're all anxious and we'll be excited to see what the next few weeks bring. When we talk about learning between the two platforms, one thing that we've learned is that teachers have had to embrace this virtual learning model very quickly, and they've had to develop the online teaching skills. But we know that it takes time to be effective to teach in a virtual forum. And so how are you measuring teaching ability? And Dr. Dupre, maybe you can start us off since Fort Bend has already kicked off classes. How are you measuring teaching ability and competence across the wide variety of teachers that you have, some that come in brand new and some that have been here for years, but may not be used to the online model? Can you share some thoughts?
Absolutely. So this morning, we actually had an extended training with all of our principals about monitoring for effective instructional delivery in the virtual environment. So that really is just the next stage, because, right, what do? You put a plan together, you design it, and you implement it, but you've always got to go back and check for success. And that's one of the biggest things we learned from the spring is we have teachers across the board in terms of their interest and ability to teach online with success. And the interesting thing is it's not age related, because to be able to be successful, you have to be willing to take a risk. And many people, just like in the normal, outside of the education population, some people are risk averse, and it's scary because they think they may push that one button that's going to cause everything to go away. But we've tried to, through our teacher development, all of our teachers had twice as much preparation time this year as they have in the past. And we had a very carefully scripted professional development plan for them so that they could learn all of the tools, all of the expectations, so that all the teachers are using a similar platform and the similar procedures so that the students can have a common, equitable experience. And it's interesting because I was talking to a 30-year veteran teacher, and he shared with me, he says, really, I'm at a greater disadvantage than the brand new teacher because I'm having to unlearn 30 years of teaching practice. And so across the board, they're all in the same boat, learning how to do this together, which we have really found is building effectiveness and teamwork among our teachers in a way we did not anticipate.
Thank you for that. I listened in on one of my children's teachers, and she said it's okay to make mistakes because you learn from mistakes. And so hopefully this environment is allowing our teachers the space to make mistakes, but then to learn from them as well. Right. Dr. Lathan, I'll ask you the next question, and this is around our students who have special needs. It is very hard for students with special needs to learn in a virtual format. And so I was wondering if you could speak a bit about what HISD is doing to support these special needs students while they stay in the virtual platform.
Yes, next week we're actually launching our parent labs. And parent labs are for students, for parents that have students that have an IEP. It will be catered to that individual student's needs. And so the parents will have an opportunity to participate in the labs, meet with district staff, receive an overview of our instructional continuity plan, the resources that will be available for their child during the virtual instruction. We also have some additional supports that will be provided as it relates to a check-in for all of our special education students during that 6 weeks of remote learning, also face-to-face or physically distanced home visits so that we can check on our students to ensure that they're okay. And then encouraging our parents to reach out to us through our hotline, which is 713-556-4636 if they have any questions. But we're actually taking a different approach than we did in the spring, is ensuring that we individualize services and needs for our parents first, then roll those resources out to their child.
Absolutely. You need to take care of the parents so that they're then able to support their children. Dr. Dupre, is there anything else that you might want to add from a Fort Bend perspective with respect to our special needs students?
So what I would add is our team has worked so hard and so long to get in touch with every single parent personally. They've been getting a number of phone calls. They're doing ARDs to make sure that everyone's in agreement, because we have to be compliant every step of the way. So lots and lots of conversations. And we're actually, even though we're online, we're actually beginning we're going to begin a number of our special education students on Monday in the building face-to-face, because we do realize, and we're hearing great significant feedback from parents, that it's just not working for so many of our students with certain needs. And so that is going to be a test of face-to-face instruction for us, because we've got about 1,000 students that are going to be live in our buildings. And I'm thankful for the teachers who are willing to do that, because the students need them. Mm-hmm. And teachers are willing to take a risk and come back to work to meet with those students. So I think that's a big step forward. But we are committed every step of the way to listening, working with parents to make sure those special kiddos have their needs met each step of the way.
That's wonderful. And I'm sure the parents appreciate your efforts. I wanted to take a step back and ask you, we've heard a lot of stories about different cities that have already started school for the last 2 or 3 weeks. And what lessons have you learned from those cities as they've gone through their school reopening? Are there lessons learned that you have brought into your plans that have influenced how you may or may not roll out certain platforms? So maybe Dr. Dupre, you can start us off with this question.
Well, I'm going to be honest. There's still a lot of learning going on. One of the things we're learning is that something as simple as a high school passing period presents a great challenge, trying to move kids throughout a building. So we're really trying to take note on what it looks like, because I think this is something I would like everyone listening to really hear. People have an idea of what school should look like based on generations. And so I think when people are thinking we're going to go back to face-to-face, they assume you drop off, they get on the bus, all of those things, and they just go about their day, and maybe they're wearing a mask. But when you think about even children congregating at the door to come in the building, right, to have their temperature taken, all of those things. So I think we're going to have to really manage expectations about what it's going to look like every step of the way, from getting on the bus, getting off of the bus, getting to your class, changing classes, going to lunch, recess. What do you do with recess when you can't play on the playground and you can't congregate? So there's so many pieces. And so I don't know of anyone who is far enough ahead of us, honestly, that we've learned a lot from them yet. But we're definitely watching everybody who's starting ahead of us, and calling other leaders and calling those districts to say, what did you learn? What are you figuring out? Because we are definitely we want to benefit from what others are learning, so we can do our best and avoid some of those same pitfalls.
Yeah, absolutely. Well, maybe Dr. Lathan is looking to you, Dr. Dupre, since you've already started school, at least online.
He texted me, I can tell you that.
We connect at least twice, 2 or 3 times a week. So I'm giving him until tomorrow before I send the next text to say, how was your first week?
It's very kind of you. But, I think in this environment, we really are learning from each other, right? Whether it's a superintendent talking to another superintendent, teachers talking to other teachers, and parents talking to other parents, because we're all in it together in terms of how we support our children. So that's fantastic, which actually leads me to the next question that maybe Dr. Lathan, you can kick us off. Parents are being stretched in multiple directions. Some of us are working from home and trying to support our children as they do virtual learning. Some of us are essential workers, and so we've had to find alternate childcare. And then, there's asynchronous assignments and synchronous conversations happening, new terminology that none of us were familiar with 2 or 3 weeks ago. And in all of this, I think parents are struggling with prioritization. And so I was wondering if you could give us some thoughts on how parents is there a framework that parents can use to prioritize the most important components of virtual learning, whether it's 6 weeks, 8 weeks, whatever the future brings. What are some ways to prioritize the key components of virtual learning so that their children can have the best experience and so the stress levels are reduced in the family?
Thank you. Great questions. Well, number one for HISD, if parents would go online and take our virtual instruction parent orientation course, that will provide parents with strategies that they need to support their students. So that's number one. Number two, attend the virtual open house or meet the teacher night with their child's individual school, where they will actually walk them through their schedule. Some of our students that have been identified in needing additional support will also be assigned a virtual academic tutor that will be providing assistance to them, or students whose parents, like you said, they just need that additional assistance. We'll be assigning those adults personnel to help them. So number one, take the virtual parent orientation course, attend the virtual open house, find out or notify their school if they also are in need, number three, of technology, and call us at 713-556-4636. I know I sound like a public operator, but it's so important that parents know that we are going to partner with them and assist them with their needs.
Thank you. Dr. Dupre, any thoughts for our parents?
Well, I'm going to be very direct. What I'm finding through my email and through social media is parents need to be the parent, and they need to keep a calm frame and a calm head and guide their children gently through this challenging season, because our children already have enough anxiety and their social emotional well-being is already stressed because they miss their friends and they miss their teachers and they miss the routines. But when parents allow themselves to get worked up and stressed and angry, we know that's coming through in the home with the child as well. Again, I'm not saying in an abusive, negative way toward the child, but our children feel their parents' demeanor and what's going on, and they're upset with the school, they're upset with the school district. And I understand there's a lot of frustration because the schedule we have requires parents to be with their children, the younger ones anyway, because our children are online for several hours a day learning directly with their teachers, which we believe is the best way to provide that education. We learned in the spring that simply posting assignments, that's not teaching, that's just doing assignments. So we're trying to do our very best to fulfill our community's expectations, but we have a lot of frustrated parents right now because it is intruding upon their work schedule. And I understand that. My grandson, who is 8 and in the 3rd grade, is with me for the first 9 weeks of school. So my wife and I are living the experience ourselves at home. And thankfully, I have a wife who does not work outside the home. But even with her, I'm getting those calls several times a day asking for, no, this is not working, this link is not working. And so we're living it to a certain extent. And so it's just parents, our constant message for parents is to extend grace to the teacher, work directly with the teacher. Our teachers are so comfortable working with parents and our campus administrators, and they can help with a lot of issues. If it's stressing the family, let the parents know, and they're there to help, and they can be flexible in a lot of ways. But where we can be flexible is our kids need to learn. I found that some of our parents do believe that an asynchronous program would be easier, or having flexibility might be easier on the family. But when I talk to parents, I remind them it still requires the same amount of time. And then in many cases, if you're doing it on a flexible schedule, you're doing it when you've already worked a full day and you're not at your best and your child is not at their best at 7 or 8 in the evening. Yeah. And so I know it is so hard. And I'm actually doing a meeting tomorrow, as I know several other superintendents are, with the Greater Houston Partnership, because I've met with some other chambers in our region, and our goal is to help the business community realize how flexible they need to be with parents right now. Because some of our parents are at fear of losing their jobs, trying to help their children, and I just don't need parents feeling that way. They need to be able to feel comfortable supporting their child working with us without anxiety about their livelihood and paying the bills going forward. So we've been trying to advocate for that flexibility in the business community in collaboration with us as well for some time.
Thank you for that. I think it's a good reminder that we need to be kind to ourselves and we need to be kind to others, and that kindness is really going to take us down this journey. If we could maybe switch the conversation a little bit to safety and health. We do hope that the schools will open, and obviously you all are all planning for it. Dr. Dupre, maybe you can start us off. What safety precautions is Fort Bend ISD going to take to prepare for in-person learning when the buildings open? Will there be temperature checks, masks? And I think the most important question for a lot of parents is, how will you ensure physical distancing, especially among the younger children?
Well, all of the above. Everything we're doing aligns with the three things we know: maintain your distance, cover your face, and wash your hands. And so, all of the staff members, even today, every day when I come to my office, I wear my mask when I come in, and I wear it anytime I'm not in my private office with the door closed. But even more importantly, I do what's called the Live Well app. It's our wellness program in the district. Every employee must complete that app every day. And when we get to the building, we have a wellness monitor at each door, and we have to show them our green screen of success that we have no symptoms and no issues. And then they take our temperature and we get a little sticker. And we're going to continue that with all staff in all buildings as everybody comes back to work. So our goal is to keep the virus out of our schools. We know it's not going to be perfect, but that's the goal. So all students will also have a temperature taken every day when they come back. All students at all grade levels in our district will be wearing masks when they're moving out and about and when they're in the classrooms. There'll be limited times when they can take them off, but we're working through face shields and face coverings of different types to meet the needs of our students. But we're going to have cleaning bottles and wipes and all of those things everywhere. And we're going to actually have much more additional staff in each building that's constantly wiping down doorknobs and those kinds of things that are touched by various people throughout the day. We still don't know exactly how we're going to do lunch, or I should say, I don't know. I know we have a plan, but up top, it's not in front of mine, whether we're going to serve in the cafeteria or not. We're still working out a lot of things with recess and some of those details, but we're going to have what we're going to do when we open for face-to-face is we're going to bring in 1 or 2 grade levels at a time, because we need, first of all, for the staff to learn how it works and get it operate with fidelity. Then we need a few grade levels, because if we bring everybody back at once, you lose control very quickly. So we want to bring in a couple of grade levels, get it down with them, and then bring in another 1 or 2. So it's going to be very staged, but we're doing everything. Again, we're working with a number of specialists in infectious diseases, where we have a member of our oversight committee that does exactly this disease infection prevention in the hospital locally. So we're leveraging their expertise, and they're telling us, this is how we keep hospitals safe. This is what you need to do in your schools.
Thank you for that. Dr. Lathan, I think our viewers would be very interested in hearing what HISD is doing to prepare. Are you going to be following similar protocols? Are there other things that HISD is thinking about? You have almost 170,000 students, if the number is correct. And so that's a large number of students to bring in. We'd love to hear your thoughts.
Okay. So we actually have 209,000 students, because I want all of them to show up. So if you say 170, we might lose some on Tuesday, September 8th. But actually, similar to what Dr. Dupre stated, we're doing everything. There's one difference. We are asking our parents and students to take the district mask. There are some questions and concerns about which mask protects students. And so there were questions about, can I bring my own mask? And so we're going to be encouraging students and staff to take the district mask, because of the fact that we purchased them. We know that they meet those safety guidelines. As it relates to lunch, definitely for elementary and middle school students, we will provide breakfast and lunch in the classroom initially. High schools, they're still working that out because high schoolers are totally different, and so we're looking at options, of course, for them to be able to go outside at designated times. Everything else that Dr. Dupre mentioned are similar for HISD.
Wonderful. Well, I hope your teams are able to work through these plans in a way that, the parents are also comfortable. And I know the parents are going to be looking forward to hearing more as you get closer to opening the schools. It is likely that there might be a case or two of COVID in a school. And so I was wondering if you could talk us through, and maybe Dr. Lathan, maybe you can start us off here. If there is a case of COVID-19 in a classroom with a teacher or a student, what is the plan of action? Who gets notified? What happens to that classroom? And at what point do you consider returning to a fully online model? What is that threshold? What is that degree where you say we have to close the school and really return to that online model?
Thank you. And actually, I will be actually stepping off shortly. We have a board meeting where our board is actually voting on some revised progress measures to emergency constraints that they adopted in the spring. And they address student safety, staff safety. And as it relates to, let's say, one particular classroom, a teacher or student becomes positive. Of course, our health and medical services director, there's a protocol that she follows with interviewing staff, interviewing students. And then she's coordinating with the county health department. Decisions are made about, of course, the student or staff member that tested positive, how many days those students and staff members need to quarantine. The building is cleaned immediately. We do send out the notifications. Of course, we don't identify the staff nor the student. And then let's say the entire class needs to quarantine for 14 days. The next day, those students log in virtually. So every day, students are taking their devices home with them. In the event we need to switch not only from one classroom, one school, or district-wide to a virtual platform.
Thank you for that. And Dr. Lathan, we really appreciate you spending time with us. We know you have to go to the board meeting, and so good luck with that. And if I may transition to Dr. Dupre, what plans does Fort Bend ISD?
Bye, Grenita.
Bye, Dr. Dupre. I'll call you tomorrow.
I'm sorry, Rosina.
I would love to hear what plans Fort Bend has in case there are cases of COVID identified in a school, in a classroom, within the staff or within the children and student population.
Yes, it's very similar to what Dr. Lathan mentioned. What we have contact tracing set up that we have been using in our organization. We have a very structured protocol around that. So it's what you would expect. We're basically, if a case is confirmed, we will be identifying anyone they had contact with. And this is where our pandemic management plan that we shared with the board Monday comes to bear, because what that indicates is based on the exposure, it's possible we could quarantine a classroom of students or a limited number of people from a campus, or we could maybe need to shut down a campus. And based on contact tracing and the exposure in the home, maybe even more than one school in a region. But we're trying to make sure that we are consistently studying the data on a school-to-school basis. And we're going to be looking at all that data on a district basis. But our goal is to be able to address localized issues one at a time. We're trying to figure out if we can get in a partnership. That sounds bad. We're working with some local healthcare agencies to try to develop a partnership for testing. So the most important thing we need to know is if someone believes they have the virus, they need to know quickly, and we need to know quickly. So we really want some partnerships where we can send a staff member or student to a local facility and get a very quick turnaround, so we can notify others more quickly about an actual confirmed case or whether it was just a risk. We're not, so we're really working on a partnership to that end.
I think that's really helpful for us to understand, and I think this will help parents as they decide which model of learning they want to continue with in the future. One of the things that we've learned through this pandemic is that there is a significant digital divide between a lot of segments of students within the community. And there's significant concern about the impact of this divide, especially on our low-income students. Mm-hmm. And I know Fort Bend has done a lot to get technology into the hands of students, but I would love to get your thoughts on what you are doing to identify and support those who didn't engage in online learning in the spring. There's a certain percentage in both districts that we couldn't find or the district couldn't find, or we know that those individuals didn't engage. And so what are you doing with respect to this fall semester to bring them online? And what sort of support mechanisms are you providing to those students?
So I think the big shift from spring to fall is that compulsory education is in full force. and we're taking grades, and they have to earn their grades, and they have to be in attendance 90% of the time to earn credit for the year. So we've had a number of parent communications to that end. And we also did, and Dr. Lathan mentioned this earlier, we did an online kind of a verification of enrollment 2 to 3 weeks ago. Well, as of last week, we had accounted for about 92% of all of our students that we were expecting to account for. We have a partnership with the county on a program called Saved by the Bell, where we have attendance officers that work with us. So at this point, we're doing phone calling, text messaging, we're visiting homes, and the goal is to help identify, number one, is a student, are they okay? Are they going to be participating in school? Many parents, unfortunately, are choosing to withdraw their children and do what they're referring to as homeschooling.
Right.
And that's always concerning to me, because I believe some of those children are going to come back to us in 6 months or a year, and they're going to be behind, and we're going to have to work to close the gaps for those children. So I think some parents believe that's easier than trying to do the online learning. But in the end, I think the child, the family, and the district will struggle to help that child get caught up. But our real goal is just to consistently have that message and to really reach out our principals, our campus staff, because they have the relationship with the student directly. There's a lot of direct contact going on, and we're finding more and more of them. But we just want to make sure that they understand how important it is that they really engage with school online to the best of their ability. And as you mentioned, we have distributed, I believe, over 25,000 devices, tablets, and laptops. We've distributed about 5,000 hotspots to help students connect to the internet. And we're going to continue to do that as much as we need to give students the resources they need to be successful.
Well, in addition to technology, a lot has been shared in the papers about the impact of the pandemic on children's social emotional health. And I would say the parents' social emotional health as well. And when we talk about the schools providing an education, we also recognize that schools step in to support the social emotional health of our children. Now, in a virtual environment, what is a district like Fort Bend doing to help support those needs for both, for students and for parents?
We're doing two things. The biggest thing we have going on is every student is participating in some form of social emotional curriculum right now. And a lot of it's taught in tandem with other subjects. But I know, for example, at our high schools, they have an 8th period that's a 20 to 30 minutes period of the day that all students are required to participate in, that's about their social emotional well-being. It's teaching those life skills. It's really helping them frame, what's going on and their response to it. But I have also dropped in on a few classes, and what I see is teachers, because our teachers just love their kids. And they're just loving on them. And you go to the little kids, and the little kids, they type anything in the chat to let the teacher know. I mean, they tell their teacher anything and everything that's going on. My mom's mad at me right now, but the teachers read that, and our teachers are so skilled at engaging the children and helping to address and kind of assuring them and loving on them and showing them that care, to letting them know they're going to be okay. Just take it one day at a time. You're going to be fine. Our high school teachers do the same thing. The other thing, last year we opened eight counseling centers in the district. And I tell you what, it was perfect timing, because those counseling centers are very active right now. Students and their families are being referred to these centers, and they're doing telemedicine style of services, not face-to-face, but you can get online and you can have a session with your counselor. And that's really helpful for many of our students who have struggled with ideation and different issues during the last year, during this time where they're just feeling depressed and down. So that's the main thing we're doing for parents. And you said this earlier, the idea of being kind to yourself and showing yourself compassion. Every message, I think the best thing that in Fort Bend we're doing for parents is we're providing real-time, transparent, authentic communication, letting them know that we understand where they're at. We know we're parents too, we're grandparents too, we're walking this journey with you. We're here to support you. Be kind to yourself. If you can't get it, it's okay, and tomorrow's another day. We're all here with you to help your child succeed. And we're getting a very positive response to the fact that we're just being open and honest, because, people make up stories when they don't know information. And so we're consistently trying to just give them what they need. And I'm sure as a parent in Fort Bend, you could probably give me lots of feedback, but I thank you for not doing that while we're live on camera.
We'll have a separate conversation offline. It's been a great experience so far. And I think just like any other parent might say, the first week is hard, whether you're in school or whether you're doing it online. And so you have to work through those kinks, and we're all going through that journey together.
Mm-hmm.
So I will ask you a follow-up question with respect to the role of a school. Fort Bend has done a lot to provide food for students who need that support. School supplies, technology we just discussed. In fact, the Ismaili Muslim community just participated in a school supply drive this past weekend with Fort Bend ISD to ensure that students are set up for success as they start the school year. What else can individuals and community organizations do to step up during this time?
You know, Rosina, you've really hit it all on the head. We've got several things going on. One of the silver linings through all of this is we have built a strong partnership with the Houston Food Bank, and they are bringing trucks into our community on a regular basis now, and that was not happening before. But our child nutrition staff has served meal after meal, and as you mentioned, I actually came to the Ismaili Center on Saturday for the event that the organization put on here locally, and it was thrilling to see so many people and so many volunteers from the center working to organize all those school supplies. We have a number of faith-based entities, nonprofits working with us to do that. But we're looking for everything from underwear to deodorant to anything a child might need, because just a lot of children today are struggling economically, and they need everything from food to clothes to school supplies to personal hygiene items. So that in any organization that wants to organize a drive and with their organization among their community, they can reach out to us. We have all this information is online, but we have a division of collaborative communities. And Panda Talati is the executive director of that area. And she does a remarkable job of coordinating with any organization in our community or individuals who want to volunteer and do those things. We are seeking volunteers regularly as well for mentoring of our students during this season. That's another way we're tending to social emotional needs, is doing remote mentoring. Was you can drop in on a Zoom call with the child and their parent and visit with them. We've actually partnered with child cares and faith-based entities who have child cares in private schools, because many of our students of working parents are in child care. And so we have partnered with them to actually train their staff in how to support the children with the Fort Bend ISD online learning. So that has been a very successful partnership with over 60 private child care organizations who have been well trained in that area. So those are the big rocks, but our community has really stepped up in a big way to support our students and our district during this pandemic.
Well, I'm sure that the viewers who are listening here might get some creative ideas on how we can support, and so you might be expecting some calls in the near future.
Well, good.
I will ask one additional question with respect to the school environment. Usually the schools provide a lot of extracurricular activities, whether it's sports or music, band, debate clubs, and all of that disappeared in March for many of our students. And a lot of us don't know whether those activities will restart. Could you talk a little bit about what your plans are for extracurricular activities? Will they be offered in a virtual environment? And if they're not, do you have any suggestions for parents who are trying to develop a more holistic education plan for their students?
Absolutely. So we've got a couple of different things going on. First of all, we have the University Interscholastic League. They govern all athletics, fine arts, and academic competitions and those kinds of things. As of today, we should be resuming UIL activities on Monday, the 7th of September. Now that could change based on the climate in our community. As of today, the number of cases, the conditions are dramatically improving, and we hope that trend continues for the next 2 weeks, because that will allow our football players and volleyball players and marching band kiddos to get on the field, on the court, and start getting back to what they love. But I don't care if you're talking about sports, fine arts, or the Latin Club, or academic decathlon, or student council. We've got so many students involved, and for most all of our students, that activity is their home away from home. It's their school family, it's their community. So absolutely, if the organization can do anything remotely, they will be doing it via Zoom. Clubs can still organize and elect officers and plan activities. All kinds of things organizations can do remotely. May have to take some creativity, as you mentioned a minute ago, but we do. All the club sponsors are in gear. Even our football team in some of our schools, they can't meet for practice, but they're getting workouts and they're meeting with their coaches every day, and they're learning drills, and they're learning things. Our music kids, they're doing orchestra and choir and band from home, which I know is very fascinating for some of our parents to have to watch and listen to that,
Yes.
especially in the beginning bands. But we are continuing on. So yes, absolutely. All of those things are part of the robust school experience that we want to make sure continue.
Thank you for that. I will ask you a question that's a bit controversial right now, and that is the idea of learning pods. So there's been a lot of conversation about a small number of families coming together and putting together learning pods. I know Fort Bend has started learning centers, or is about to start learning centers, although you have had staffing challenges. And these learning centers are not going to accommodate everybody who wants that experience. And so what is your opinion on families turning to these pods? And what are your thoughts in terms of equity, with some having access and the financial resources to do this and others not?
Well, I think equity is always going to be the bottom line. Equity has been the theme of every conversation we've had in Fort Bend around this pandemic, because we know with our dramatically diverse student population, we have many students who are going to be at risk. And so we are doing our part to maintain an equitable learning environment to the very best of our ability. In my view, if parents choose to organize in the community, I don't think that economic status has to be a barrier. I think that there are many students who may not come from wealth, but they're members of church communities or communities that they could still, parents could do what they can to adjust their work schedules or be as flexible so a parent who happens to be off can supervise the children. And so I think any family who wants to organize with other families to meet each other's needs, it's essential. It's what a community does. And I've said that from the beginning, because many families dealt with childcare issues back in April and May while they had to work while the children were not in school. And so my constant message to families was, be good neighbors, help your neighbors to the best that you can. We all have the risk, I know, of the virus, which is always, that risk of exposure is always dangerous. But if you have someone that you can, what do they call it, a quarantine? If you have other families that you can quarantine with, where you all have been tightly quarantined and you're safe, I would say take advantage of that. But I don't think it has to be an equity problem. I think many communities can do that. You just have to be willing to reach out and ask and accept those offers and do it with people you trust and right? I mean, not just anybody, but I think it is a good way to help the community support one another.
Well, thank you for that, Dr. Dupre. It looks like we're about out of time, so I will stop here, and I want to thank you for participating. Dr. Lathan did have to leave, but I did want to thank her as well. And I also wanted to thank the viewers for taking time to participate. And with that, I will hand it back to Shazia to close it out.
Thank you for having me today.
Pleasure.
Thank you, Dr. Dupre and Dr. Lathan, for a truly insightful discussion. Having the opportunity to discuss your timely perspectives on an issue that is affecting us all so intimately has been extremely valuable. On behalf of the Ismaili Jamatkhana and Center, we also want to thank each and every one of you that joined virtually from your homes across the United States. We hope that you found the program to be as valuable as we did. To get more information about the Ismaili Jamatkhana and Center, please go to the.ismaili in your web browser. And for more information on upcoming programming, please go to the facebook.com/the Ismaili USA. We look forward to sharing future programming with you. Thank you and good evening.